Hi everyone, I am Dr. K. Hemanth Kumar, Consultant Surgical Gastroenterology and HPB Surgery at Manipal Hospital, Old Airport Road, Bangalore. Today we will discuss about one of the very common surgical ailment which we usually encounter in our clinical practice, that is incisional hernia. As the name says, it is a kind of or a variant of hernia usually seen in surgical sites. How do we diagnose or how do the patient get to know that he has an hernia? The patients usually develop a swelling at the surgical site, which at times might be painful, which may not go inside, what we call as an irreducible. So if someone notices a swelling at the previous surgical scar which is causing pain and not going inside, then we can be confident that the patient has developed an incisional hernia and we deal accordingly. How do we diagnose these incisional hernias is, one is based upon the clinical history and examination, and then we subject them to investigations like ultrasound scan and a contrast enhanced CT scan. So once we diagnose that someone has an incisional hernia, we always advise, depending upon the complexity, for surgical options, as hernia is a progressive disease. There are no medicines to cure it, and usually most of the patients require surgical treatment for the treatment of hernias. So open surgery for incisional hernias is usually done in complex cases or multiple recurrences or a large defect sizes. In those patients we usually advise for open hernia, and again there are different techniques depending upon the where we place the mesh. And most of the times we are successful in operating by minimally invasive surgeries like laparoscopic and robotic surgery, especially for smaller hernia sizes and even in some cases where the hernias are recurrent. And coming to the advice in the post-operative period for patients who undergo surgery for incisional hernia, we usually call them for follow-up after a week to look for the status of the wounds. By that time the wounds would be healed, and we put them on small soft diet for initial few days and give painkillers in the post-operative period. And once by a week, when the patient is fit, we advise for another few months the patient to use abdominal binders, what we call as abdominal belt, to prevent recurrences and also to give some comfort to the patient. And we advise them not to gain weight and also not to get involved in strenuous activities like rigorous physical activities initially for few weeks to few months, depending upon the clinical condition. And incisional hernias are very common, and people should not ignore, especially if they notice any swelling near any preoperative surgical sites. Thank you very much.